In this lecture, I will be talking on IgA nephropathy. It is also known as Berger's disease. IgA nephropathy is an autoimmune disease induced when galactose deficient IgA 1 recognized as autoantigens by unique IgG autoantibodies. And as can be seen here, this is the secretory IgA. It is actually dimer IgA connected by J joining, and as a hinge joint or as a hinge region, there is galactose or glycan. So deficiency of galactose at the hinge region will predispose to IgA nephropathy. So formation of immune complexes IgA, IgG, this will lead to activation of the classical pathway of the complement, and as can be seen here, this is the glomeruli, or this is the glomerulus. So some of IgA, IgG immune complexes will get deposited in the mesangium. So this is the mesangium, and actually the position of IgA, IgG immune complex or complexes as a mesangial cells or as a mesangium will lead to activation of the mesangium or the mesangial cells, and this activation will lead to proliferation of mesangial cells. So activated and proliferated mesangial cells will produce interleukin number 6, tumor necrosis, factor alpha, and TGF beta, and this will lead to inflammation, and this inflammation will destruct some of small vessels in this area, and also podocytes may die by apoptosis, and this will lead to proteinuria and destruction of the blood vessels due to pro-inflammatory cytokines, and activation of the complement may lead to hematuria. So the trigger of this, IgA nephropathy, is upper respiratory tract infection and gastroenteritis. However, the genetic background plays a role in pathogenesis of the disease, as it is linked to chromosome 6q2223. In IgA nephropathy, the glomeruli show deposit of IgA and C3. These are the glomeruli. They show deposit of IgA and complement component number 3. And IgA nephropathy or Berger disease peaks at the age between 15 to 30 years old. So this is the localized form of IgA pathology. However, the systemic form of IgA pathology is known as IgA vasculitis, and this result in a disease manifest as Henoch Schonlein purpura nephritis. So usually the patient is a child, and this present with lower limb or trunk rash, and usually the rash is non-blanching rash on pressure, and also it is associated with nephritis, proteinuria, and hematuria. So the manifestation in the systemic form of IgA pathology could be nephritic or nephrotic syndrome. So diagnosis, to build up a definite diagnosis, renal biopsy is very important to confirm the diagnosis. Treatment, there is no cure for IgA nephropathy. However, to avoid serious complication, the patient is put on immunosuppressant, omega-3, and medication for high blood pressure. Thank you very much, Professor Ahmed Pollard.